Hello everyone. My name is Dr. Senthil Jayaseelan. I'm a consultant anesthetist and pain medicine specialist. We are doing a series of videos where I ask the specialists in different areas certain questions which will be very useful for medical students if they are going to think about taking a career in that specialty. So today with me, I've got one of my closest friend, Dr. Aravindan, who's a consultant psychiatrist from the UK. So I'm going to ask him a few questions, which will be very useful for you. So Dr. Aravindan, hello there. How are you?
Hello, hi, Sandhu. Nice to meet you.
Good to see you too after a long time. Now, I'm going to ask you some questions, okay? So this is supposed to be very useful for medical students. So I'm going to ask you some controversial questions too. So my first question would be a fairly recent or reasonable one. As a medical student, if I'm thinking about a career in psychiatry, what would you say about your specialty which will persuade me to take psychiatry?
Okay. I mean, I can talk about psychiatry for the whole day, but I'll just try to keep it as short as possible.
Well, that'll be good.
Okay, so I think psychiatry is a unique field of medicine, which I find personally very interesting and rewarding, I use the word unique actually, why it is unique, and I can give some reasons. I think first and foremost, it is the field of medicine, it stands out compared to, other subspecialties of medicine, And how can I put it? Say, for example, if you work in general medicine, if you branch out into respiratory medicine or gastro, so you'll know that many of the skills you learned is transferable and applicable. But when you come to psychiatry, you know that it's entirely a different field. These skills are not transferable or applicable. So you have to learn from scratch again, the knowledge you have to acquire, the skills, the new skills, and etc. So that's what it makes somewhat different, in terms of the basic difference, I'm talking about. And also as a clinician, the other difference which you may come across is, unlike other specialties, this is not heavily dependent on investigations. Nowadays we have a variety and multitude of investigations which you rely upon in other specialties to reach a diagnosis and even to formulate a management plan. But in psychiatry, you have only a handful of investigations which you use to rule out, mainly to rule out certain conditions, after which reaching a diagnosis, the care plan, how you manage them is entirely up to the clinician, your knowledge and skills, So that's what, it makes a bit different, from other subspecialties. But there are probably two key points as well, which make it, again, different from other specialties. I think it'd be very useful for the emerging doctors to know about this. And psychiatry is perhaps the only field, or maybe one of the few fields, which takes a very holistic, person-centered approach. In mental health, we just don't focus on the illness, and then treat the illness, and then you say it's you're doing well. Bye, see you later. No, we don't do that. We not only the illness, and we assess the impact of the illness on the individual, and also the various domains of that individual's life, how it is affected, for example, personal life, family life, social and occupational life. You try to take a holistic approach. You tend to form a connection with the patient and form a good therapeutic relationship, and use these things, in your approach to help the patient recover. So use the term actually biopsychosocial model, in psychiatry. So that is a key difference, just not one, you don't just base your treatment just on medicine, but also the psychological approaches. If there are any social issues, you also try to address them, And the third thing is that we could have noticed that we just don't rely upon medicine, So for you to deliver that or meet the care needs of the patient, you clearly need a team, made of professionals from different backgrounds. Say, of course, I was trained in UK for many years. I was working there for a long time. If you take a UK, a typical psychiatric team will be consisting of course, consultant psychiatrists, junior doctors. On top of this, you have psychiatric nurses, and then clinical psychologists, and occupational therapists. In some teams, they have art therapists. You can just keep on going, you know. So it's a truly a multidisciplinary work you need to do. If you are a person who enjoys this team working, being part of the team, and leading the clinical team, and really it's fantastic, you know. So this is the uniqueness, you know, of working in psychiatry. And personally, I find it interesting and rewarding, I said, and why? Because, you know, as human beings, we are always interested in knowing about our fellow human beings, you know, the behavior, who they are, and what kind of personality they are. So again, it is very natural also for you to be more curious about these people who have all these psychological difficulties. What is that they're suffering from? Why they're suffering from? How I can help? You know, and psychiatry is the field which is of course, a scientific branch of medicine, which helps to, you know, understand these patients, you know, with these difficulties, and help them to come out of this distress. You know, so in that sense, I find it very interesting. You know, the patient may be having the same sort of diagnosis, two different people, for example, depression or schizophrenia, but how it is affecting them, how they are reacting to the illness, it's entirely different. So, you know, you cannot think that just one same diagnosis and same treatment I'm going to give. It's entirely different. So that makes it very interesting. Why it is rewarding when you put them back on track, help them to recover, help them to live a normal life or a near normal life. That's really fantastic. You know, it's amazing feeling actually. You know, I have during my time, I have treated people from various backgrounds, including doctors as well. To be honest, actually, yes. So this is really, you know, end of the day, the mental health is the ultimate wealth, which all of us are really craving for. You know, in that sense, it is very rewarding and very satisfying.
Excellent, 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 Dr. And it's very, very, very useful information there. Now, I also heard that psychiatry has got a lot of subspecialty areas. Would you want to talk a little bit about subspecialty areas within psychiatry?
Yes, absolutely. Again, you know, when I was outside psychiatry before entering into psychiatry, I saw psychiatry simply as a, you know, a small branch of this big tree, this medicine. And maybe at times I thought that was just a small twig as well, you know. But once you are into psychiatry, you realize that psychiatry itself is a big tree with sort of many big sort of branches. To, you know, I think approximately there are around like 12 to 14 sort of subspecialties, you know, we can step into, especially if you are training or you know, psychiatry in Western countries. To name a few, you know, child psychiatry, adult psychiatry, old age, and then you have this forensic psychiatry, which deals with, you know, a lot of violence and aggression and all those things. And then there is a neuropsychiatry and psychiatry for people who suffer from learning difficulties, and there is addiction psychiatry, and then there's a perinatal psychiatry. It just goes and goes and goes. It's not only the branches and also the services as well, you know, and a variety of services through which you deliver care, you know. Say, for example, if you take adult psychiatry, you have the inpatient unit, intensive psychiatric care unit, a crisis team, a community psychiatric team, and then a city outreach team, and then rehabilitation team. So you can just see that there are so varieties of services as well through which you deliver this care. So if you're entering into psychiatry, you know, depending on your interest in the specialties, you can branch out and you can enjoy
Well, that's
practice.
really very good, actually. I mean, so you can actually pick and choose what you want to do, from what I can see, and they're quite
Absolutely, no, there's a
interesting
very,
fields, actually. Yeah.
yes, there's really a variety. You know, sometimes you may be spoiled for choices. You know, not knowing which one to go for
Well,
because I
as
follow every.
as a medical student, I mean, we were in the same college, so we would know. So the exposure to psychiatry has been to a very bare minimum, and I didn't know that so many subspecialty areas are there in psychiatry. Well, that's very good to know. And now coming to the more controversial side. So, are there any challenges in your field which has ever made you think about regretting? I mean, have you ever regretted taking this field because of those challenges, or if you have never regretted taking the field? Should I know about any problem areas that I should be considering before I take psychiatry?
I think so. This is a really fantastic question to ask because when you think about some specialties, we always think about the positives in it, why I'm going to like it, you know what I mean? And we don't tend to think much about what could be the possible challenges, I may come across. It's a very good question. I think, I think when I was in doing my undergraduation and I was doing my internship, at that time itself, I decided, I loved psychiatry during my first exposure to psychiatry itself. So I'm still enjoying it, and every day is a new day for me. It's really amazing. But having said that, so what are all the challenges? Is there anything that frustrates me? Yes, absolutely. Like any other field you are working in, of course there will be some challenges. Let's be honest. But what I'm finding it, but somewhat challenging or frustrating, I think the biggest thing is the stigma. When I say stigma, it's been going on for a long time. Even the Royal College and other associated organizations are fighting against it through different programs and stuff. But what intrigues me is that, you know, not only the patients, sometimes the mental health professionals are also face this heat of it, this discrimination or sort of prejudice. Maybe prejudice is the better word here, especially when a patient with mental health problems go to emergency department or present in A&E or get admitted in a medical ward. Sometimes you feel really sorry for them. They're not treated like, with utmost respect. Sometimes, when you go and assess these patients and try to help them out, and then you also get a taste of it, at times, it's just not nice. Uh, what makes this sort of, what intrigues me is that we are not immune to mental health problems. In fact, actually, mental health issues are the biggest problem, as human beings we face. Nearly 25% of the population during the lifetime will go through some sort of mental health problems or psychological difficulties. And despite this, other healthcare professionals or departments and fields of medicine and starting to behave differently when they come across someone with mental health problems. That really kind of puzzles me. And it can be frustrating at times, to be honest.
I totally agree. I mean, I said with any specialty, you will have challenges, and particularly in psychiatry. Because I work in chronic pain, I do feel for you. I mean, you must be facing a lot of challenges. Yes. Right. Okay. So let's go back to our positives now. If I want to take a career, I mean, like become a psychiatrist like you, what should I do to prepare myself as a medical student?
I think I would give a very simple advice, but a profound advice. Okay, to experience it and get exposed to psychiatry. That's the most important thing. I love psychiatry. I enjoy psychiatry. I can describe it. I can talk the whole day about psychiatry, and you can develop some sort of understanding about it. You're not going to experience psychiatry without stepping into it. It's about like me talking about a nice dessert which I enjoy the flavor and the smell of it. But you can't really understand it unless you really experience it. So what I would suggest is, depending upon wherever you are living, where you're working, and try to work in psychiatry if possible, get some attachment, if possible, a minimum of 3 to 6 months. And that will help you to understand, how things work and how things operate, in psychiatry. But if you are not in sort of big places or big cities, and if you don't know what to do, but still it is worth going and approaching or speaking to a local psychiatrist. And if they're happy to have you, you can just shadow them, at least for, preferably maybe a month or two. And you can also have a discussion with them, and these things will help you to experience it, to be honest, a slice of psychiatry, maybe let me put it that way. And then that will put you in a better position to decide whether it is the right field for you or not. Yes, that would be my advice.
Thank you very much, Dr. Arvind. It was really useful, and for not only it will be useful not only for the medical students, but also for medical professionals like me, and who are working in different specialties. I mean, it has given a very beautiful insight into this vast area of psychiatry. Now, I hope this interview will be useful for all the medical students who are watching this. But what I would like to ask you is, would you be happy to take some questions from them in the future? if they think about anything in the area of psychiatry, and thereby you can be certainly a very good guiding force for them. Is that okay with you?
Absolutely. It will be my pleasure to help the sort of the future generation, and it's a way of also attracting sort of good candidates into psychiatry as well. Why not?
Excellent. So it'll be a good recruiting ground for you to get people into psychiatry, and I think it's very much needed, especially after this COVID. I mean, like many medical professionals will be under a lot of stress, and also generally people, the patients as well. So I think it'll be a very good specialty for the medical students to think about to take up as a career in the future. Thank you very much, Dr. Ravindan. Thank you very much.
Thanks a lot, Senthil, for this opportunity.
Thank you. Thank you.
Yeah, thank you.